Hi, we're here with Stephen. And with Stephen, we did a topographic guided laser reconstructive ablation where we actually reconstructed his prior surgery to actually make the optics of the cornea better, to make it smoother. We segmentally remove parts to get rid of laser decentration and to get rid of a small laser area. So, Steve, tell us a little about what your experience has been.
Well, before I had my surgery with Dr. Matwani, I went to basically every LASIK surgeon in San Diego County. I even called LASIK surgeons in Los Angeles. And unless I was a former patient, there was only a few surgeons that would actually touch me. If I was one of their former patients, no one would have anything to do with correcting my vision. So after meeting Dr. Matwani, he assured me that this is definitely a doable thing. I did a little more research on him, his background, his history, and I settled on him to do the surgery, and it's worked out incredibly well. I'm so very glad that I met him and have had this opportunity to use his service, because my vision is now a little better than 20/20, and after being told by other surgeons that I would have serious issues and problems trying to have something like this done, I've had no problems. Everything's been awesome, and I just want to thank you so much.
It's wonderful, wonderful. Yeah, it was interesting because Stephen was in for his I think it was 6 months or 3 months or 6 month visit, right?
Yes.
Just last week, and I walked in the room and he started saying this to me, and I said, "Wow, people need to hear this." Laser reconstructive repair with topographic guided ablation is not very common. There's only a few people that I know of in the United States performing it. At the moment, I am the only person that I know of in the West Coast. I wrote a protocol for it that was published in February of 2016. With this, we can actually reconstruct people that have a radial keratotomy, decentered LASIK or PRK, corneal trauma, keratoconus or other corneal ectasia. So people with pretty severe irregularities of their cornea. And one of the things that happens is, even if you take someone like Stephen, who had a decentered small laser ablation done many, many years ago, and you actually just treat the correction, the prescription, because the cornea is irregular, when you do a symmetric new correction on top of that, it's still irregular. That means the epithelium is going to change, it's not going to work out right, and over time, it's just going to get worse again. And then on top of that, the optics aren't good. It's kind of like a lens from a camera where you actually have a lens that's not smooth. It's actually a lens that has different layers and different areas in it. And that doesn't make for a great picture. And one of the things that he noted was, your vision was good. And I think your night vision was good too, right?
Pretty good. It's better now.
Yeah.
Much better now.
Yeah. That's what I'm saying, that your night vision has improved.
Oh, immensely. I don't have the halo effect I had.
Yeah.
And
Yeah.
I can see clearly day or night.
And so this is something we set up a separate website for called cornearepair.com. It's C-O-R-N-E-A repair.com. And I think having someone like Stephen on really gives people an idea that we can fix some of these things that people are having problems with. And we are having people come from different areas, and different cities, and different states to have us repair these problems. But it's a pretty big deal because we didn't have this power, this ability a few years ago. And there are certain people that are willing to get into this and understand how to use these systems. But it's something we here enjoy. And thanks, Stephen, for again the honor of doing this for you.
Thank you.
All right,
Thank you
my
very
friend.
much.
Fabulous. Thank you.